final lecture is going to be meningitis and encephalitis. Now, I know most of you will confuse these two. What is meningitis and what is encephalitis? Meningitis is generalized inflammation of the meninges. It's a generalized inflammation of the meninges. Encephalitis is a generalized inflammation of the brain parenchyma. Now let's draw a diagram. Let's draw the brain structure. The superior colliculus, the inferior colliculus, this is the midbrain. Then we have the pons, then we have the medulla, and we have the spinal cord. Let me move this a bit to the side. Okay, this is the brain. And what is the covering of the brain? We have the pia mater, actually of the whole spinal cord. Everything is covered by the meninges. The first layer is the pia mater, touches the brain. You get it touching the brain. Next, we have the arachnoid matter, but before that, we have the subarachnoid space. And finally, we have the dura mater. The dura mater is the hard fibrous layer which is present outermost in the meninges. This is the dura mater. This is the arachnoid matter. This is the subarachnoid space. And this is the pia mater. Now, this is a very important concept and you need to understand this. Which of these layers are affected in meningitis? It's going to be the pia mater and the arachnoid matter. Why? So the arachnoid matter and the pia matter, this region is called leptomeninges. Leptomeninges. Why? Because these are delicate structures. The reason it's a delicate structure. While the dura mater is a hard structure, and inflammation or infection of this is called pachymeningitis. Pachy meningitis. Remember, when we are talking about meningitis, we are talking about this. Okay, so to recap, meningitis is an inflammation of the leptomeninges. That is the arachnoid matter, the subarachnoid space and the pia. Encephalitis is inflammation of the brain. These are generalized inflammations. So we'll first talk about cerebrospinal meningitis. Cerebrospinal meningitis. So in this case, there is going to be purulent inflammation in this region. So what happens here is we are going to have our blood vessels. They give off branches inside. Bacteria group of bacteria called Meningococcus can come and colonize the CSF region. They can enter into the CSF space. So the subarachnoid space has CSF. So these Meningococcus will come here. Now, there are around 5 white blood cells per microliter of CSF. That's a normal value. But in this case, there is going to be an increase. There's going to be white blood cells coming here and there's going to be an inflammatory reaction here. Inflammatory reaction. So what is going to happen is there's going to be white blood cells coming in. There's going to be substances produced. There's going to be proteins produced. Glucose, which is normally present in CSF, will be taken up by the white blood cells, and that will reduce. This patient will have several signs and symptoms. And what is important here is this type of meningitis we are discussing is common during the winter and spring. In children less than 10 years of age. So the clinical signs are going to be called first, there is going to be meningeal irritation signs. That is, inflammation of the meninges will definitely cause irritation of the meninges. So how do we check this? It's called this different signs. First is stiff neck, and you check for that using Brudzinski sign. Next, Koenig sign. Koenig sign will be positive. Next, let me show you these two. So this is Koenig sign. This is a clinical examination. You will have to do this in your 4th year, where you have to raise the patient's leg like this to this position, and then holding the knees, you bring the leg upwards. When that happens, there is going to be pain to the patient's back. There is going to be back pain. So what will usually happen is this patient will raise his head up. Brudzinski sign is going to be the opposite. When we pull the neck upwards, when we flex the neck, the hips and the knee will flex like this. It will come up like this. The other sign of meningeal irritation is called opisthotonus. This is an image of that. These patients will appear like this. This is the most comfortable position for them because of the pain. We also have symptoms such as photophobia and phonophobia. Now this is a very important sign. These patients cannot stay in the light, so they need to be in darkness. We can also get other symptoms such as intracranial hypertension syndrome, cranial nerve damage, which can lead to cranial nerve paralysis. Then if you test for CSF, you will see different changes. I talked about some of it. So there will be increase in white blood cell count. As you can see, white blood cells will come. Then there will be an increase in proteins, a decrease in glucose, and the pressure, because there's going to be edema here. So the CSF pressure will be increased. Also, septicemia. So what is septicemia? The toxic products, all these inflammatory products, can enter into blood and it can cause septic shock. A complication of this is called hydrocephalus. Another complication, sorry, let me add it here. So what is hydrocephalus? You can see the bulging of the head due to fluid buildup in the meningeal space. So this is going to be bulging of this space, the whole head actually, but just to show it in this diagram. Next, we talk about encephalitis. So what is encephalitis? This is generalized inflammation of the brain parenchyma. Now what you need to know is this affects gray matter. Next, it's most severe, I will use different shades of red. So bright red to show where it's most severe. The cerebral cortex. Now, if you know anatomy, you will know we have the basal nuclei and the optic thalamus. The thalamus is here. There's two thalami. There's a Y-shaped gray matter region with several nuclei. So these are thalamus. I didn't draw the cerebellum. This is going to be the cerebellum. You need to draw the meninges around it. So the next will be the slightly milder, will be this region, the cerebellum. So this is cortex, basal nuclei, optic thalamus. These are most severely affected. Less severely affected are the medulla and the cerebellum. Moderately severe. And least of it will be the spinal cord. And that too only in the region of the neck. Now what is important in this lecture is not going to be the clinical signs and all. It will be these images. Now what I need you to know is this came for MCQ, and this was the hardest part for me in the MCQs. Like, I cannot stress how important this is. When you do the lecture, when you do the practical classes, I need you to understand, you need to focus a lot on this. This and this is called a vascular cuff. This structure is called a vascular cuff. Now you can see the white blood cells have come around the vessels, around the blood vessels. This is for encephalitis. Then this image is called a malactic dots. Malactic dots. These are regions of edema, hyperemia. You can see all around. Then we have satellitosis. So the glial cells will be around the neuron cell body, accumulated like this, similar to satellites. So they will come, accumulate like this. Next, we have neurophagocytosis. Neurophagocytosis. What is that? There's going to be destruction, neuronal destruction by the glial cells. Glial cells are the macrophages of the nervous system. Neurophagocytosis. And finally, we have microglial nodules. Like I said, glial cells are the macrophages of the nervous system. Remember this, in infectious disease, the most important point are these images. They will come not for the practical exam, they will come for the main exam as MCQs, and these are the hardest part for you to get right, because they won't give you these images. They will give you different images, so you need to be able to identify these images. So when the teacher does the practical class, make sure you listen well to this part. I will briefly talk about the clinical symptoms. So first, we will get a variety of symptoms, especially based on where, the type of organism affecting. This is most commonly caused by Japanese encephalitis. This is a mosquito-borne disease, and this is therefore common in summer and autumn. So the clinical symptoms include lethargy and coma, cerebral edema, and intracranial hypertension. So with intracranial hypertension, I didn't explain it here, but we get three things. We get headache, vomiting, cerebral hernias. And finally, the meningeal irritation signs can be found. Some sequela or long-term disorders, even after the disease is cured, include dementia. This is basically a disease where you lose your memory, reasoning, all of it. It's basically called being senile. If you watch politics, you will know Trump calls Joe Biden senile or sleepy Biden because he's said to have dementia. These are the sequela, cranial nerves. So what happens here is, if there is going to be damage or inflammatory damage to the corticospinal tract, there can be limb paralysis. Cranial nerves can be affected, leading to paralysis of cranial nerves. So you get similar features such as facial palsy in this kind of situation. That's it for pathology. Remember, this is the most important part in all infectious disease pathology. There were around 4 MCQs out of 23 MCQs in total from this section.